Hello everyone, this is Dr. Ravali Yalamanchili, Chief Dermatologist, NEA Dermatology and Aesthetics. Today let us discuss about what are freckles, why do they occur, who is more prone for it, what can we do to avoid them, and what are the different treatment options you can opt for. Freckles are these faint brown spots we usually notice on the cheeks and even on the nose and sometimes in forehead areas. These are completely asymptomatic, that they don't cause any itching or burning sensation and are of a pure cosmetic concern where they look like these brown spots on the face. Freckles are mainly because of two reasons. One, they're common in people with genetic predisposition. Two, sun exposure. Sometimes even in people who are not in the sun for a very long duration, they can get freckles. When it comes to genetic predisposition, there is not much that is in our hands or we can do something about it. Secondly, when it comes to sun exposure, we can definitely use a good sunscreen and cover up the areas when you're out in the sun for a very long time. Because when you're out in the sun and come back indoors, the freckles tend to look even more prominent just by exposure to the sun for a few hours. It is important to understand that when someone has freckles, just using a sunscreen once in the morning is not enough and they will have to reapply it every 3 hours or so. And also, the quantity of the sunscreen is very important and we have to use 2.5 fingertips of sunscreen for face and neck. There are various treatment options for freckles. But one needs to understand that freckles are something which are recurring and they do not have any permanent solution. Also, there is no way we can remove a freckle completely and we can only reduce the prominence or lighten them. Freckles are more common in lighter skin individuals than in darker skin individuals. Some of the creams that you can use at home for treating freckles other than sunscreen are creams rich in antioxidants like your vitamin C, niacinamide, kojic acid. Some of the in-clinic procedures are very effective in treating and lightening the freckles. Some of the treatments that we usually do for treating freckles are 1. TCA or trichloroacetic acid peels. TCA in higher concentration when applied on top of a freckle will help reduce it by literally ripping off the skin of its superficial layers. The other treatment we also do for treating freckles is radiofrequency. Radiofrequency also helps in removing the superficial layers of the skin and thereby lightens freckles for a shorter duration. But the gold standard treatment for treating freckles is a Q-switch and YAG laser. Q-switch and YAG laser works by reducing the pigment cells, thereby lightening the freckle. One needs to understand that whatever is the treatment option that you opt for, you will need maintenance sessions to keep up with that. If not, the freckles will come back. When you're considering Q-switch and YAG laser for your freckle treatment, you might typically need around 4 to 6 sessions and you might need a few maintenance sessions, 3 to 4 months, depending on how they are and how frequently they're coming back. A good sun protection in clinic procedures like Q-switch and YAG laser will help you keep your freckles under control. If you need more details about these treatment options, please leave a comment below. If you like this video, share it with your friends and subscribe to my channel.